Do you want to live your healthiest life? If yes, please spend few minutes with me and I will teach you something new. But first, let me ask you, do you know the status of your kidney or cholesterol level? Living healthy is not just about eating kale or hitting the gym. Regular health tests are your secret weapon to catching issues early and staying on top of your game. Today, we're breaking down the must-do health tests everyone should know about. Let's dive in. First up, blood pressure. This quick test measures how hard your heart's working to pump blood. High blood pressure can sneak up without symptoms, raising your risk for heart disease or stroke. Get it checked at least once a year at your doctor's office, a pharmacy, or with a home monitor. The normal range is around 120/80, so keep an eye on it. Next, let's talk cholesterol. Think of it as the traffic in your arteries. Too much bad cholesterol can cause a jam. A simple blood test checks your LDL, HDL, and triglycerides. Adults should get this done every 4 to 6 years, starting in your 20s, or more often if you've got a family history of heart issues. If you're going for cholesterol test, fast for 9 to 12 hours before the test. Don't take your vision for granted. A comprehensive eye exam checks for vision changes, glaucoma, and other eye conditions. Adults should get one every 1 to 2 years, especially after 40, or if you notice blurry vision or eye strain. This will help keep your world crystal clear. Your thyroid is like your body's thermostat, controlling energy and metabolism. A thyroid function test checks hormone levels to catch issues like hypothyroidism or hyperthyroidism. Adults over 35 should consider testing every 5 years, or sooner if you're feeling sluggish, anxious, or noticing weight changes. Cancer screenings save lives by catching things early. For women, that means mammograms starting at age 40 to 50, depending on guidelines, and pap smears every 3 to 5 years for cervical health. For everyone, colorectal screenings kick in at 45. Talk to your doctor about what's right for you based on age and family history. Diabetes is not a joke, but catching it early can change everything. A blood sugar test, like an A1C or fasting glucose test, measures how your body handles sugar. Adults over 45 should test every 3 years, or sooner if you're overweight, or have risk factors like family history. Stay sweet, but keep those levels in check. Ever wonder what's going on inside your blood? A complete blood count, or CBC, checks your red and white blood cells and platelets. It can spot anemia, infections, or other issues early. Most adults should get a CBC every 1 to 2 years during routine checkups, especially if you feel unusually tired or bruise easily. Strong bones keep you moving. A bone density scan checks for osteoporosis, especially important for women over 65 or men over 70. Get it done every 2 to 5 years if you're at risk, like having a family history or low calcium intake. Your kidneys and liver are your body's cleanup crew. Kidney and liver function tests, like creatinine or liver enzyme tests, spot issues before they become serious. Get these checked every 1 to 2 years during routine blood work, especially if you're on medications or have risk factors like diabetes. Your skin takes a beating from the sun. A skin cancer screening by a dermatologist checks for suspicious moles or spots. Everyone should get a full body check yearly, especially if you're fair-skinned or spend lots of time outdoors. Protect your skin and catch issues early. These tests, blood pressure, cholesterol, blood sugar, cancer screenings, CBC, thyroid, bone density, eye exams, kidney, liver, and skin checks are your health's best friends. They're quick, often covered by insurance, and can catch problems before they get big. Grab your calendar, book those appointments, and take charge of your health today. If you have any questions, drop them in the comment section or visit the hospital and talk with your doctor. And remember, your health, your concern.